Good evening to one and all. I'm Dr. D.R.AJAY from the Department of Conservative Dentistry and Endodontics, Sri Balaji Dental College and Hospital, Bharat University. Today, I'm going to be talking about direct filling gold. So, these are the contents. We're going to see about the introduction, history, properties, indications, contraindication, advantages and disadvantages. And we're also going to see about the different forms of gold, biological considerations, annealing or degassing, conclusion. So, introduction. Among the available restorative materials, direct filling gold is the oldest filling material that is still used in restorative dentistry. The vision to utilize the noble metals for the replacement of lost tooth structure stems from perfect harmony of its biological and mechanical properties. While most of the metals can be welded and alloyed at a temperature above the room temperature, the pure gold can be cold welded and made to adhere to each other at room temperature. For a patient, gold foil means no second appointment, no second administration of LA, and no second application of rubber dam. Lastly, as quoted by B. Smith, it may serve the tooth for a lifetime. So, as you can see, this is the history of how the gold filling evolved. First, it started in 1483 by Giovanni Arcol, who first recommended gold leaf as restorative material. Then, when you see the evolution, you can see next the subsequent events of introducing gold foil restoration. So this goes as it is. And in 1840, Jackson first introduced sponge gold, which was easier to condense. And in mid 1850s, Robert Arthur of Baltimore introduced the technique of heat pieces of sponge gold over a spirit lamp to make them cohesive. And in 1896, Bryan referred to matte gold. So finally, in 1989, a new granular type of gold called a stopped gold was introduced by D.A. and Dragelstein. So coming to the properties of gold, it has an atomic number of 79, atomic weight of 196.9 daltons, melting point of 1064.4 degrees Celsius, and boiling point of 2870 degrees Celsius. The density of pure gold is 19.3 gram per cc. The Brinell's hardness number is 25, but cold working increases the hardness to 58 to 82. So gold is the most malleable metal that is they can be hammered into thin sheets, as we have studied in our high school about this property. And it is a noble metal, most biocompatible, and is not affected by air, heat, moisture, or most solvents. Coefficient of thermal expansion is 14.4, which is that is close of the tooth enamel, which is 11.4. It has high thermal conductivity, and the tensile strength of gold is capable of holding a weight of 7 tons per square inch, according to Hyams. It is not soluble in nitric acid, hydrochloric acid, sulfuric acid, but it dissolves in aqua regia. Aqua regia is nothing but the combination of nitric acid and hydrochloric acid. It also dissolves in potassium cyanide and solutions of bromine and chlorine. After work hardening, its hardness is equivalent to and may exceed that of type 1 gold alloy and approaches that of type 2 gold alloy. Because of modification of properties by work hardening and final restoration is considered to be the wrought metal. So where are these gold restorations indicated? So they're indicated in incipient caries lesions, occlusal buckle, such as occlusal buckle, lingual pit, class 2 lesions on premolars and molars, and class 3 in mandibular anteriors, class 5 in bicuspids and cuspids where aesthetics permit, and erosion areas, and repair of defective margin of a cast gold restorations. And it is also indicated in atypical lesions such as proximal lesions on teeth adjacent to crown preparation, class 6 lesion, retrograde root canal filling material, lesions in which cavity margins can be located on sound dentin surfaces, lesions in vital teeth having sound pulpal dentinal organ, intact periodontium, and ability to withstand condensation forces. Patients with good oral hygiene, low caries and plaque indices, lesions with adequate access for detailed preparation and instrumentation, teeth with no enamel crazing or micro cracks, Pure gold is the ideal restorative material for permanently preserving tooth structure in non-aesthetic low stress areas. This is an important point. So moving on to the contraindication, uh, gold restoration should not be indicated in very young patients and old patients, teeth which has large pulp chamber, periodontally weakened and root canal treated teeth, where economy is a limited factor, and handicapped patient. And some more we can see, such as caries prone mouth, hypersensitive teeth, extensive cavities, and with weakened walls, lack of skill of operator, psychologically unsound patients who fear malleating forces. So these can also be a contraindication for gold restorations. And as we all know, we can't give gold restorations as an aesthetic filling. And in undesirable occlusal stress areas, hypoplastic tooth, and in case of underdeveloped roots. So advantages of gold restoration is it is insoluble in oral fluids. It is more resistant to tarnish and corrosion. Perfect adaptation to cavity wall. Great density, crushing resistance, and edge strength. Low tendency to molecular change, and long lasting and durable. No intracement substance is needed. We don't have to give a polycarboxylate base or anything like that, so we can directly fill the tooth with the gold itself. The thermal expansion similar to dentin, it's the finest and kind to the tissues, and it causes no tooth discoloration and maintain high polish. And coming to disadvantages, we have inharmonious color. Thermal conductivity can be a problem in newly restored teeth, can lead to sensitivity to hot and cold, and the of course the manipulation of tooth is difficult to master. It is also expensive and patient discomfort, and it cannot be used in deeper cavities. So use of gold in present dentistry, direct filling gold, it is classified into direct filling gold and cast gold. And we have inlay, onlay, gold crown, and full gold crown, and direct filling. So characteristics of cast gold alloy is type 1. We have 4 types. Type 1 is soft gold alloys for restoration subject to very slight stress such as inlays. Type 2 medium gold alloys for restoration subject to moderate stress such as onlays. And type 3 hard alloys for high stress situations including onlays, crowns, thick veneer crowns, and short span fixed partial dentures. And type 4 is extra hard alloys for extremely high stress states such as endodontic posts and cores, thin veneer crowns, long span fixed partial dentures, and removable partial dentures. Alloying elements in gold alloys are, we have four: platinum, palladium, which are used to obtain surface oxide solution hardening; iron, tin, indium, which gives strength, hardness, and stiffness; and iron reacts with platinum, forming intermetallic compound which precipitated within the solid solution. Neither silver nor copper is added because they produce greenish discoloration to ceramic. So, coming to the types of direct filling gold, we have gold foil, electrolytic precipitated gold. Under that, we have matte gold, matte foil, gold calcium alloy, and powdered gold, granulated gold, gold dent. So, gold foil, it comes as sheets, pellets, cylinders, and ropes, which are laminated, platinized, and corrugated. So gold foil, nothing but they are the sheets which are manufactured by a process called as beating or rolling. All lightweight sheets are formed by beating, and heavyweight sheets are formed by rolling. In beating process, first heavier mallets are used, followed by lighter ones as the gold gets thinner. For rolling, it is passed through rolling mills until desired thickness is obtained. It comes in a book of 1 by 10 or 1 by 20 ounces. One book has 12 sheets with a common dimensions of 4:4. Number 4 gold foil weighs 4 grains and it's 0.51 microns thick. Number 3 gold foils weigh 3 grains and is about 0.38 microns thick. During manufacture, pure gold ingots are subjected to cold working, thereby creating sheets out of blocks. As the gold is subjected to strain hardening during this process, for further cold working towards the formation of these sleeves or sheets, the material should be subjected to proper annealing. This alternate process of cold working and annealing That is, the gold working continues until the desired thickness of the gold sheet is arrived at. So coming to extra pliable gold foil, it was made to produce a more cohesive gold. Extra pliable gold has improved tendency to cohere. It is formed by wrapping a loosely formed regular gold rope with an extra sheet of gold foil. Then moving on to gold foil pellets, it may vary from half to 1/28th of a portion of number 4 gold foil. After removing the gold foil along with the tissue paper from the book, foil is held on paper and is cut to the size needed. Paper supports the thin gold foil and prevents it from tearing and wrinkling during manipulation. Sizes used are 1/10 onwards. Larger size of 1/2 and 1/4, 1/8 are used for making cylinders. The desired piece is then grasped by index, thumb, and middle finger of left hand. Ends are touched with tweezers towards the center and are rolled into loose balls. Pellets are degassed and stored in separate compartment. So as you can see, this is the picture of the gold pellets. So then moving on to gold cylinder. Gold cylinder can be hand rolled or commercially rolled, made by rolling the cut segment of number 4 foil into half, 1/4 and 1/8 widths. And moving on to corrugated gold or carbonized gold foil. This was first observed by dental dealer in Great Chicago Fire of 1871. Corrugated gold foil is manufactured by placing a thin leaf of paper between two sheets of gold foil, after which the whole container accommodating paper, leaves, and gold foil is ignited. As the paper leaves are burned out, they shrivel and thereby impart a corrugated shape of the gold foil. It has been proven that corrugated gold foils are more cohesive than the plain ones. Next comes the platinized gold foil. It is a sandwich of gold and platinum content being 15%, with platinum content being 15%. One sheet of platinum foil is sandwiched between two sheets of gold foil and is then hammered to the thickness of number 4 gold foil. Layers of gold and platinum are rolled over together so that their fusion of the two before the beating procedure begins. Platinum increases the hardness and wear resistance of the restoration. So this form can be used in stress concentration areas like incisal edges and cusp tips. Then coming to laminated gold foil. When a cube of gold ingot is cold worked in order to formulate a sheet, the cubical crystals of gold will be stretched and elongated in a specific direction. If the gold foil of that cube is viewed under a microscope, it appears fibrous with the fibers parallel to each other in a specific pattern. This type of gold foil material will have directional properties, that is, it will be resistant to stresses in one direction better than the other. The idea of laminated gold foil is to combine 2 or 3 leaves of gold, each from different ingots, which have been cold worked in different directions. Although each leaf will be directional in its properties, when combined together, they can be resistant in different directions. Therefore, laminated gold foil is definitely much stronger and much more resistant to stresses than the other forms of direct gold materials. So gold foil is further like it comes in 3 forms, which is cohesive, semi-cohesive, and non-cohesive. First, let's see about cohesive gold. It is that form of gold which is essentially free of any surface contaminants and can be placed directly into the cavity. Gold can attract gases to its surface, and any adsorbed gas film can prevent intimate atomic contact required for gold welding. So manufacturers supply the foil free of surface contaminants and therefore inherently cohesive. This type is referred to as cohesive foil. So moving on to semi-cohesive gold, some gold sheets have observed protective gas films such as ammonia. This minimizes the absorption of other less volatile substances and prevent premature cohesion of sheets. Volatile film is readily removed by heating to restore the cohesive character of the foil. This type is referred to as semi-cohesive gold. Moving on to non-cohesive gold, non-volatile contaminants like iron, sulfur, phosphorus are permanently deposited on the surface. This cannot be driven away by heat, and so gold loses its cohesive property. Non-cohesive forms are used as starting material since they can be worked more easily than cohesive forms, but they don't have good strength and hardness. So moving on to the electrolytic precipitated gold. It also comes under in three forms, such as matte gold, matte foil, gold calcium alloy. Matte gold. Matte gold is also called as sponge gold. It is an electrolytically precipitated crystalline form that is sandwiched between the sheets of gold foil and formed into strips. These strips are cut into desired sizes, preferred for its ease in building up the internal bulk of the restoration, as it can be more easily compacted and adapted to the retentive portions of the prepared cavity. As it is loosely packed, it is friable and contain numerous white spaces between the particles. So it is recommended for the external surface of the restoration. Using this two material technique, the mat is covered with veneer of foil. Loosely packed crystalline form with large surface area of the matte powder. It does not permit easy welding into a solid mass as does gold foil. So the advantage of matte gold is rapid filling internal bulk, that is cavity wall and retentive portions. It is used to form the core of the restoration. Average size is 10 to 20 microns. Disadvantages: it is difficult to handle. Voids do get formed, and surface pitting, ditching, and rough finishing. More condensation pressure is required. Crumbles during manipulation. Does not permit welding into homogeneous mass. So moving on to matte foil. This is a sandwich of matte gold placed in sheet of number 3 4 gold foil. Sandwich is sintered by heating to just below the melting point of gold and cut into strips of different widths. The gold foil cover holds the crystalline gold together while it is being condensed. Matte gold foil differs from the so-called cohesive type foils. It is a fine electrolytic crystalline deposit made adhesive by nature of its finely divided crystalline structure and by extremely pure state of the metal itself. Its mechanical strength is the result of a special molding and heat treatment process. This property renders it easier to manipulate. Because matte gold foil is highly adhesive and cohesive, and because it is more readily adaptable than the other types of gold foil, it is ideally suited for building up the internal bulk of Class 5, Class 1, and occlusal portions of Class 2 restorations. Moving to alloyed electrolytic precipitate. This is an alloy of electrolytic gold and calcium. In 1969, it was introduced by R.V. Williams and Ingersoll. The newest form, electroalloy RV, is unalloyed with calcium. The calcium content is usually 0.1 to 0.5% by weight. Its purpose is to produce stronger restorations by dispersion hardening. For convenience, the product is sandwiched between two layers of the gold foil. So moving on to powdered gold. It is a blend of atomized and precipitated powder embedded in a wax like organic matrix. This form was introduced in 1962 by Baum and Lund. The atomized and chemically precipitated powders are first mixed with a soft wax to form pellets. These wax gold pellets are wrapped with foil. The resulting pellets are cylindrical and are available in different diameters and length. It's commercially available as pellets of powdered gold wrapped in a gold foil known as gold dent. It was introduced in 1960s. The individual particles or granules are 15 microns. Of 15 microns are gathered into a mass of irregular shape, ranging in size from 1 to 3 millimeter, pre-condensed lightly to facilitate handling. These masses are encased in an envelope of foil to make it easier to convey them to the cavity. Easy gold. Easy gold is similar to golden, but with improved working properties, marketed by Williams Gold Refining Company in New York, introduced in late 1980s. It is a mixture of pure gold powder and wax, which is wrapped in a gold foil. Its manipulative characteristics are similar to stiff amalgam, yet more cohesive than gold foil, hence the name Easy Gold. It is metallurgically similar to gold foil and powdered gold in that when properly and thoroughly compacted, it has comparable properties such as inertness and permanence. It is recommended for use in small class 1 and class 5 lesions. It is less time consuming and more predictable. Greater expected longevity and more favorable tissue response. So Easy Gold is the new gold dent by Alpestin, Yearwood, JOD. Soft gold. Soft gold is a new direct filling gold. New direct filling gold material that is considerably different from other direct goals, has been available since 1989. The advantages are that the final restoration exhibits greater density than other forms of granular gold and has a 50% increase in shear strength when compared to gold foil. Clinical experience with the use of this new restorative material has been encouraging. So we let's summarize the type of the gold and their uses. First comes gold foil. Its main uses are restoring small pits and narrow fissures, and also used to veneer other forms of corrosive gold. Then matte gold is building up the internal bulk of restoration, not used on the surface for restoration since it has a tendency to become pitted. And moving on to powdered gold, it is a bulk filler and for the restoration surface. And alloyed filling gold is restoring all classes of cavities where corrosive gold is used most frequently. So moving on to biological consideration of gold, energy of condensation which is not absorbed by the restorative material may dissipate to the pulp dentin organ. Thermal energy in the pellet exceeding that needed for decontamination causes pulpal irritation. Frictional heat of finishing and polishing. Galvanic current between gold and other metallic restorations, and ultrasonic energy from high condensation frequency can harm the pulp. Need for a base. So generally we give a base when there's 3 mm or more of remaining dentin thickness. If there is 3 mm or more of the remaining dentin thickness, we don't give any base. So if there's 2 mm or more of remaining dentin thickness, we give varnish on walls and floors. Between 1 to 2 mm, we can give a sub base of calcium hydroxide or unmodified zinc oxide usinal over this varnish. Then use zinc phosphate cement or zinc polycarboxylate. If the remaining dentin thickness is less than 1 mm, direct filling gold is contraindicated. The study done by Draham et al. On the ability of cavity bases to withstand condensation of direct gold concluded that zinc oxide usinal and calcium hydroxide containing bases have similar abilities to withstand condensations of direct filling gold. Authors concluded that zinc oxide usinol and calcium hydroxide cavity bases tested had adequate strength to resist forces of condensation of electrolyte. So, removal of surface impurities. Coming to removal of surface impurities by annealing or heat treatment, and is also called as degassing. After beating or rolling, all foils become non-cohesive. The cohesive property is developed by slow heating or annealing. All direct filling gold products are degassed immediately before use, except when non-cohesive foil is specifically desired. So, degassing is the removal of the surface impurities such as ammonia gas, wax, and other gas. Annealing is the removal of removing the surface impurities with internal stress relief, restores ductility and malleability. Annealing temperature ranges from 650 to 700 degrees Celsius depending on selected method and the heating time. It produces an anatomically clean surface which results in metallic bonding. So this is the procedure of annealing, heat treating, and degassing. So moving on to the methods of degassing. First is the open alcohol flame method, which is also called as piece method. Heating unit is used in open flame. Absolute or 90% ethyl methyl alcohol without any additives was used to produce a clean blue flame. Gold foil is held with the instrument and heated over a clean blue flame of absolute alcohol. Gold is passed over the blue flame, reducing zone, middle zone, which is the reducing zone, middle zone for 3 to 5 seconds. Temperature of the flame is 1300 Fahrenheit and heating is done until gold becomes dull red. So the advantages of this is less contamination, less wastage of material, desired size of piece can be selected. The disadvantage is, of course, it's time consuming. The second is bulk method. Bulk method is mica tray over flame method. A sheet of mica can be used over any type of flame and is used somewhat as a heating element. Divide the surface of the mica into several areas to indicate the time the pieces of gold were put on the mica. Maximally 5 minutes are allowed for any piece of gold to be heated on mica. Degassing of several gold pellets at a time is possible. Moving on to electric annealing is the most controlled and standardized way of decontaminating gold materials. With this instrument, the heated compartment area is made of aluminum. An electric heater controls the time and temperature. The surface of the heater is divided into small compartments, each accommodating a piece of direct gold. This eliminates the possibility of cohesion of the pieces before they are inserted into the cavity preparation. Maximally, 5 minutes are allowed for any piece to be kept in the electric decontaminator. Electric annealing is maintained at a temperature of 343 degrees to 371 degrees Celsius. It is used for powdered gold to burn away wax. So the disadvantages are they stick together if the tray is moved, size selection among the piece of degas gold is limited, more chance of contamination. Heating time depends on size and configuration of gold segment. Powdered gold is 15 to 20 seconds, gold foil pellet and electrolytic gold is 1 to 2 seconds. Uh, uh, Avoid overheating and underheating. So overheating is recrystallization, grain growth, incorporation of impurities, more stiffness, less ductile, difficult to condense, non-cohesive particles adhere to each other, and excessive sintering. Underheating involves partial cohesiveness, peeling away of adjacent segment or layer, pitting, porosity, and final restoration. Precautions to be taken using flame. Lamp should not run out of fuel during the procedure. There should be no surface contaminants on lamp and wick. Wick should be properly trimmed and rounded to produce a teardrop flame. Sulfur in matches could adhere to the wick and contaminate the gold, so ignite with the other end of the match. Storage of gold foil. Gold is packed into preparation under pressure so that under welding minimal porosity occurs. Protecting gold foil from contamination by gases with a thin film of alkaline salts. This protective film, usually of ammonia, prevents deleterious gases from condensing directly on the foil. Instead, these gases combine with ammonia to form other salts, and they are neutralized by it when present in excess. They are then driven off by annealing. So, coming to the conclusion, gold has been an undisputed king of restorative materials. In spite of the more recently introduced materials and techniques, gold foil still holds the leading position in choice of materials. In this modern age of dentistry with high speed and other up to date equipment, we have a tendency to forget the fine art of cavity preparation. Gold foil, more than any type of procedure, offers the best results. The option to utilize gold foil as the best restoration totally rests on the shoulder of the operator. Unless a conservative dentist takes a conscious attempt to learn and master this wonderful material and technique for many indicated lesions, the patient will be deprived of the very best treatment because of the fallacy of the conservative dentist. So these are my references. Uh, Operative Dentistry by M.A. Marzak, Modern Theory and Practice. Then Science of Dental Materials, Phillips 11th edition. William O'Brien 3rd edition. Studevant's Operative Dentistry 5th edition. And Mark Marzak's Textbook of Operative Dentistry. Thank you. Thank you for your patient listening.